2021 Master Pediatrician, Dr. Bonnie Desselle.
Good. Yeah, it's my great honor to introduce Bonnie Desselle, one of two recipients this year of the Master Pediatrician Award for the Louisiana chapter of the AAP. If you don't mind, I'm going to take a few minutes to tell you a little bit about Bonnie and all the things that she's accomplished for the state of Louisiana. She's a professor of clinical pediatrics and vice chair in our Department of Pediatrics at LSU Health New Orleans, and also holds the Leslie LaWinter Suskin and Robert Suskin Professorship of Pediatric Education at LSU. To me, Bonnie exemplifies the requirements of a master pediatrician, quote, a superb clinician who for many years has contributed to the health and welfare of children in Louisiana through direct patient care, child advocacy, while educating and serving as an outstanding role model to students and young physicians. She's excelled in at least two of these areas. She's dedicated her life to Louisiana and excellence of pediatrics in our state. To my knowledge, except for 3 years as a pediatric critical care trainee at Le Bonheur Children's Hospital, she spent her entire career in Louisiana. She graduated from LSU in 1988 after being elected to membership in Alpha Omega Alpha Honor Medical Society and received the Rothschild Award as Outstanding Student in Pediatrics. It just so happens that a previous master pediatrician, Dr. Barkmeyer, was able to provide this picture of Bonnie during the early part of her career. And I promise, Bonnie, this is the only photo that I'm going to show. Her tremendous work as a pediatric resident was acknowledged with her selection as Outstanding Pediatric Intern at Charity Hospital in 1989 and Chief Resident in Pediatrics in 91 and 92. Following this stint, she did her training in pediatric critical care at Le Bonheur and the University of Tennessee, Memphis. After that, she joined the faculty at LSU in 1995 as our first fellowship-trained pediatric intensivist. In the role, she immediately led the process of modernizing evidence-based provision of pediatric intensive care and the education of our house staff and students in these methods. She's known for excellence and efficiency in patient care in the PICU. She's been able to instill the essential tenets of critical care medicine to a generation, maybe more than one generation, of pediatric residents in a calm and reassuring manner. In less than 10 years, she rose from new faculty member to leader. She built the pediatric critical care division at LSU and Children's Hospital in New Orleans and served as its division head from 2004 to 2019. She's allowed residents to gain procedural experience essential to helping them develop confidence to care for sick children, and has influenced multiple former residents, including several of her current colleagues, to pursue additional training in critical care medicine. 25 years later, Bonnie remains as active in pediatric critical care as when she started, serving as a wise mentor to all of her colleagues. That alone is probably worthy of this award, but Bonnie's most impactful influence on pediatrics in Louisiana is in the area of residency training. In her second year on the LSU faculty, Bonnie became Associate Director of the Pediatric Residency Program at LSU and became its director 3 years later. This is a job she's performed at a high level over the next 15 years. Under her leadership, LSU Health New Orleans Pediatric Residency Program grew in size and national stature, recruiting and training the majority of pediatricians who provide care to the children in our state. She's a role model, a mentor, and an advocate for residents and students. She's been at the forefront of developing the necessary changes in residency program curricula to keep up to date. In 2006, she was recognized for these efforts by her national peers in the Association of Pediatric Program Directors with a Special Program Directors Award. A conservative estimate finds Bonnie has trained more than 450 pediatricians in her time of leadership of the LSU Pediatric Residency Program, a role she transitioned from in 2019. While possessing instinctive skills in leadership and communication, Bonnie has continually developed her skills as an educator with her work in the APPD and by earning the title of Teaching Scholar with the LSU Academy of Advancement in Educational Scholarship. She also completed a fellowship in health profession education sponsored by the AAMC. So Bonnie's recognized as a superior educator, innovator, creating innovative creator of enduring educational materials, a leader at the institution, regional and national level, and a hands-on instructor and mentor. But above all, a grand motivator, a motivator of evidence-based medical care, a motivator of professionalism, a motivator to embrace pediatrics and medicine as a calling, a motivator to do good and live a life of true value. Now, Bonnie's taken on a new role. She's assumed the role of Chief Medical Education Officer and Director of the newly established Department of Medical Education at Children's Hospital of New Orleans. In this role, she's working to incorporate both the LSU New Orleans and components of the Tulane University Medical Education Program under one roof. She's been a long time and active member of the Louisiana chapter of the AAP, and in 2017, she was awarded the Elizabeth Cassinelli Award for her special efforts in support of women's careers in pediatrics. It's only fitting that Bonnie now receives accolades as Master Pediatrician. Congratulations, Bonnie.
Well, thank you, Ray, for that amazing introduction, and all of your wonderful advice and leadership over the years. I'm attempting to share my screen. Does everyone see my screen? You're saying yes. Okay. All right. Wonderful. So again, Ray, thank you for those extremely kind words. Ray has been extremely instrumental in mentoring me, recruiting amazing faculty who are great teachers and that make my job extremely easy. I want to thank the Louisiana AAP for this a wonderful honor, and pleased to receive this award and speak to all of you today. Thanks to Ashley and Taryn for putting on another amazing and outstanding meeting, very informative. And I'm happy also to share the stage today with my amazing colleague, John Vincieri. So as part of this award, you have to speak about your career. So I was going to tell you a little bit about my story, how I got to medicine. And then, as Ray mentioned, I've had two big buckets in my career: pediatric critical care and medical education. I thought I would spend my time today, though, talking about medical education, because I thought that I may be the only one who cares about advancements in ARDS or septic shock. But all of us here today, all of us here as pediatricians have gone through medical school and gone through residency training. So I thought that would be probably the most interesting to all of us today to talk about that. And I'm going to end talking about what I hope to do as I finish my career, as well as maybe seek advice from all of you on things that we need to do better in education in Louisiana of our generations of pediatricians. So to first start with my story, it's a map of New Orleans. I grew up outside of New Orleans in a little suburb called Araby. And so I'm a native of New Orleans, 7th to 8th generations of Louisiana folks in my family. No doctors in my family, but the important piece of my upbringing was unfortunately that my mother was diagnosed with cancer when I was very young, around 8 years of age. And from that time into her unfortunate death when I was around 18 years of age, I would take her to go with her, accompanying her to doctor visits and hospitalizations. And so this is, the 70s. And so not much was done outpatient wise. So spent a lot of time in hospitals and clinics. I didn't learn, of course, as a child about medicine, but what I truly learned, which did impact me, obviously, for my career choice, and I was able to witness this wonderful doctor-patient relationship that I saw, and the trust and the hope that doctors can give to families, despite maybe not the outcome that anyone wanted. So when I was a typical high school student, college student, deciding what to major in and where to head in life, I thought I wanted to make a big impact on the world, and I felt through my experience that medicine would be the way to do that. And then I chose pediatrics as well as probably many of you, thinking that if you're going to have an impact in medicine, if you impact the life of a child, then you have the chance to impact many, many years of that person's life. So I ended up at LSU School of Medicine. and where I met some phenomenal faculty members, like some of the previous master pediatricians, like Dr. Raj Warrior, my chairman then, Dr. Robert Susskind. And I just met some phenomenal pediatricians. And they were just great role models and shaped me to what I say I became today as a professional pediatrician. And some of the things I remember them teaching me as a young medical student is that, you know, good physicians treat diseases, great physicians treat the patient who happens to have the disease, but pediatricians take it even a step further, and we treat the, you know, the whole family. So that was just a huge impact on my life. And then when I was a resident and trying to decide what type of pediatrician to be, I decided on pediatric critical care. And similarly, I thought at that time that if I wanted to have a big impact on a child's life, I should care for those who are critically ill and having life-threatening illnesses. So again, I had wonderful role models. Dr. Gates, Dr. Harris Levine at Children's Hospital encouraged me to pursue this. So I went off, like Ray said, to University of Tennessee, and the then chairman, Dr. Robert Susskind, who's pictured here, recruited me back, and I was happy to come back, of course, to Louisiana. I think this photo is around when I came back as faculty around the 1990s, and there are Dr. Warrior is that tall, handsome man in the middle who many times is mistaken for Brad Pitt, but that is Raj Warrior. Brian Bartmeyer, a past master pediatrician with a little bit more hair there, Dr. Robert Susskind, Dr. Vargas, and many of you may recognize Stuart Gordon is one of our past presidents of the AAP, and many wonderful faculty members. That was an obvious choice for me to come back and work. Dr. Susskind, though, very early on, because I'd been the chief resident, asked me to join the medical education team. And what he told me then was that, you know, Bonnie, you as a critical care doctor, of course, you will care for thousands of children and, you know, save, you know, many children's lives in your career. But he told me a famous quote that is used in medical education, or at least to recruit people into medical education. And that when you become a clinician a teacher as well, you can impact the lives of many hundreds and thousands of children that you will never meet. So I was very happy to join the medical education team, and grateful to Dr. Susskind for asking me to do that. This is a picture here of the first class that I graduated as residency director. And as you can see, just a bunch of very happy, confident, competent young folks, and it's been an honor every year to graduate an amazing group of residents at LSU New Orleans. And it's been amazing to watch them. They come to us as sort of scared medical students, scared interns, and when they graduate, they're confident and they're competent. And the additional icing on the top of that wonderful cake is watching them in their career. Like I still remember Dr. Rachel Chatters, our current president, when she was a resident and a scared intern, and now to watch her be president of Louisiana AAP just truly warms my heart. And a cherry on top of the icing under the wonderful cake that I've just described is now seeing Rachel Chatters' children, who are also becoming pediatricians, and one of her daughters is one of our interns in pediatric emergency medicine. So just a wonderful experience I've had watching these young folks mature into great pediatricians. All right, so I want to switch a little bit and talk about some of the things that I think have changed over the years since I was an intern and where we are now. So what are some of the advancements in medical education? Probably the hugest, biggest change I think that has occurred in my career is the regulation of the number of hours that residents can work, what's called duty hours or work hours. So the work hour regulations by the ACGME came about in about 2003, and there's some changes that were made in 2011. And as you all know, long and unpredictable work hours is the staple of medical training for centuries. And even the term resident is a relic term because doctors used to sleep in the hospital. They were residents of the hospital. Luckily, by the time I was a resident, we weren't sleeping in the hospital anymore, although we were sleeping in call rooms of Charity Hospital that used to be where people lived. But when I was in training, and as many of you of my generation or above, we worked easily 100 hours a week and stayed in the hospital for usually 2 days in a row. So these new duty hours came out, like I said, in 2003. And it restricted work hours to 80 hours a week, at least one day off, and you couldn't work more than 28 hours in a row. Many reasons for this: safety of the residents, of course, their well-being, safety to the patients, of course, and just to continue optimizing our clinical learning environment. I'll show you a couple of studies that I found. There are many, there are hundreds and thousands of studies done on young, healthy adults if you sleep deprive them. Many come from our military because they're concerned on what happens if someone's sleep deprived, aerospace industry. So there's many studies out there and other industries, not just in medicine, but what happens if you sleep deprive people. And this one here from the American Academy of Sleep Medicine, when they look at this well-validated sleepiness scale, residents fall between two pathologic states of having narcolepsy or sleep apnea, so not good. And the other, I think, interesting, fun study is a study that was done looking at healthy young adults. Half of them, they sleep deprived, kept them awake for 26 hours. The other half, they had them consume alcohol. And every hour they would have them do these certain cognitive psychomotor skills. And they noticed over time, they both declined at the same way. So many studies that really pushed the ACG that, hey, we needed to change this. So, gone were the days when you show up one day and you weren't going to leave for a couple of days and you hung out with your friends for a few days and had, 6 meals with buddies over a couple of days, gone were those fun days. So I thought about how to describe this a little bit more concretely to all of you. When I think back, so I started in 1988, and at that time in my residency, as many of you of my generation, we took call every fourth night. So every fourth night, you showed up at 7 a.m. and you left the next day, the following day around 4 o'clock. So you worked about 36 hours in a row. So fast forward when I started faculty, but at LSU, I came back to LSU. Residents were still doing pretty much every fourth night call, but they had these things called call-free months. And I used to laugh because I'd say, what is that? What does that actually mean? It's like, oh yeah, Dr. Desselle, we now have, at least 1 month per year that there's no call. And I was like, wow, that's really novel. That's awesome. Well, fast forward now, so many years after the duty hours, we shifted to night shifts, night float, different things like that. So in 2015, in our residency program, the only time you took call was in the intensive care units, and that was about 4 months of call over your 3 years. And now fast forward today, 2021, our residents at LSU New Orleans only do 4 nights of 28-hour call. So it's quite different. Now, before we start talking about all of us in the older generation about walking to work uphill in the snow both ways, this is Dr. Bikini, this is Ray Watts here, and I threw Stuart Gordon in there. John Vincere, I could probably have you there as well, Roberta Gary. So before we start rolling our eyes and talking about the younger generation, and by the way, you three look pretty good there. Let's talk about the patients that are being cared for by our residents these days. So there is a population of pediatric residents, not pediatric residents, pediatric patients that have complex chronic conditions, much at a greater rate than during my generation and the previous. And so this study here published in 2010, looked at 15 years of data. The data stops at 2005. So kind of old data. And I'm sure this would be even higher. This kind of grayish line compared to the dark line looks at the number of children with multiple complex chronic conditions that are hospitalized in the United States. And we have many similar studies in pediatric critical care that look very similar. So gone are the days when you look at your resident shows up and looks at patient list, or I show up for my shift in the ICU and I look at my patient list and they all just have one disease. They don't. These patients have very complicated cases, neurologic, cardiac, liver, kidney, et cetera. In addition to that, we think of our pediatric residents and pediatricians in the state of Louisiana. In addition to a lot of complex patients with chronic illness, Louisiana has our children have some of the worst social determinants of health, which adds just another layer of challenges in the care of these patients. And this leads to the next topic that I want to mention to all of you, which is the evolution of our brand new subspecialty training in pediatrics, and that is pediatric hospital medicine. So to meet demands of caring for all these complex patients, we now have this new specialty called hospital medicine. And as you all know, hospitalists, they take patients from primary care doctors and then return them back to the primary care doctors, upon discharge. But what do? They do an amazing amount of patient care, coordination of these complex care of these complex patients, as well as to do a significant amount of teaching. This picture here is our LSU Pediatric Hospital service, and Jay leads that. Jay is also the Associate Residency Director. Amy is our Student Clerk Director. Chelsea is our Residency Director. Lauren's Associate Director. And I want to point out Dr. Amanda Messer, and she's our first Pediatric Hospitalist Fellowship Director in the state of Louisiana. And then Callie Roth is our first Pediatric Fellow that we've ever had in hospital medicine in the state of Louisiana. And then Shannon runs our 4th year program. Leslie does our night float. So hospitalists are now maybe really the core of medical education for us at LSU New Orleans and in many places nationwide. They provide consistent care for these complex patients and do round-the-clock education of our students and residents, as well as do a significant amount of leadership within hospital. And the other thing that has changed really is the evolution of rounds. This is an old picture that I found of Sir William Osler from the late 1800s. And he's the one who apparently is credited for bringing medical students out of the classroom and young doctors out of the classroom and bringing them to the bedside. Like this was a novel idea apparently in the late 1800s. And you fast forward to, again, here's Brad Pitt again making rounds. You fast forward a couple of centuries later, kind of looks the same. And even for me too, this is probably, late 90s, looks pretty much the same. Me and a few young wonderful physicians on rounds. But what does it look like today? What does it look like in 2021? Well, now we have multidisciplinary round and family-centered round. So in our ICUs, our hospitalist service, we always have the patient there, and we have multiple other disciplines there with us, our pharmacists, our dietitians, our nurses, our respiratory therapists, because when you bring together all these specialists, and they each bring their expertise, it surely makes it easier for us to coordinate care, determine all these care priorities, establish really robust daily goals of care, communicate them with everyone, so everyone's on the same team and the same page, and then planning better discharge. So just a significant amount of higher quality of care. So I've enjoyed all those wonderful advancements, and I hope when I retire, maybe come back to Children's Hospital and see what rounds look like. And I hope it continues to change and evolve and get better and better for our families and patients. So the next thing I want to transition to is, many people ask me, when you look back on your career, what was your greatest challenge in your career? And I would have to easily say it was 2005. So that was a terrible year. Of course, as you all know, it's when Hurricane Katrina hit the city of New Orleans, closed our medical schools, 2 medical schools, closed all of our residency and training programs. We lost close to 2,000 citizens and $125 billion worth of damage. The silver lining here is that amazing work done by our residents, our faculty, nurses, respiratory therapists who stayed, of course, in the hospitals at Charity Hospital, University Hospital, University Hospital, Charity Hospital, University Hospital, and Children's Hospital, and took care of the most vulnerable of patients during this horrible disaster. So this is the crew at University Hospital, the LSU Tulane nurses, faculty. This is the I don't know why this keeps going backwards, sorry. The LSU crew, and there at University Hospital, and one at the bottom is Children's Hospital. And I could never give a talk about LSU pediatrics in my career without giving a shout out to Our Lady of the Lake Hospital. and LSU Department of Pediatrics, so Dr. Roberta Vicari, as well as Dr. Stuart Gordon, who without them, LSU Pediatrics would have closed their residency program. It would have taken us many more years to recover. And instead, this miracle thing happened. We knocked on their door in our evacuation clothes of t-shirts and jeans, and introduced ourselves and told them what we do. And they opened up their hospital, opened up conference space for us, allowed us to continue our educational efforts. And we will be forever grateful to Dr. Vicari and Dr. Gordon for helping us out tremendously then. So when I look to the future, where should I focus the remaining parts of my career, or what should I look at for even metrics of success, and then what should I look forward to maybe some improvements that need to happen? This here is a wonderful slide that I love to show. This is from the American Board of Pediatrics. So the American Board of Pediatrics keeps track yearly of the number of board certified pediatricians in every state, and then compares it to the number of children you have in your state. And then via this color code, it kind of puts you where you are in comparison to other states. And different from the slide that I had with the social determinants of health, where we're always at the bottom, we're pretty much middle of the pack here. So what this kind of busy slide shows is that we have 81 board certified pediatricians for every 100,000 children in the state of Louisiana. Really some of the best in the South. We're similar to Florida and to California. And why I bring this up when I talk about medical education, because myself, LSU Shreveport, Dr. Bikini Vancheri, Dr. Paul Cooper, the late Dr. Vicari, currently Dr. Melissa Roy and Dr. Michael Bolton, Trey Dunbar, Samir Eldar at Tulane. We have to take credit for this, because pediatric residents across the country, and definitely in the state of Louisiana, medical students, many of them stay here to train for residents. After you're a resident, where do you practice? You practice mainly in the state where you're from, in Louisiana. So we need to take credit for this great success. But where should I focus some of my time, which I hope to focus the latter part of my career, is really in our subspecialty shortages. So there's approximately 24% of children in Louisiana who have special health needs, compared to 20% average in the United States. And this graph looks at subspecialists on the far left here. So general pediatrics. So the average patient has to go 3 miles to get a general pediatrician. Again, we should be proud of this, because that directly relates to the health of your community. But look here at, say, like rheumatology, where in the state of Louisiana, the average drive is 152 miles, and the longest is 216. So I think this is where I should focus my latter part of my career, is really improving the number of subspecialists in the state of Louisiana. So I'm going to close here. And thank you again. And I have a whole list of folks I'd like to thank. One is the LSU Health Sciences Center for employing me, for accepting me to medical school and employing me for all of these years. Again, a special thanks to Ray Watts, who's been a wonderful mentor and chairman. I've been very fortunate to have many wonderful chairmen. Dr. Suskin was my first chair, Dr. Sorensen, and then now Ray Watts. I also want to have a shout out to the amazing faculty. Ray has recruited amazing faculty who love to teach, so that makes my job easier. We have amazing clerkship directors, amazing program directors. And again, I want to thank the Louisiana AAP, and I especially want to thank you for sending me the link for my family to join in today, because as a critical care doctor, my knowledge of general peds is just like, it's been terrible for many years. And my family would send me pictures of rashes, or just ask me general peds questions. And of course, I didn't know all of them. I'd have to call, one of my good friends. And luckily I have many good friends who are general pediatricians. So I think for a while, they're not really sure that I'm a pediatrician. So thank you for allowing them to view this today, because maybe my level of expertise will now be increased in my family. And of course, the very last person and the most important person for me to thank is my lovely wife, Dr. Lexi Morvant, and she's a pediatric hospice and palliative care physician, and she continues to inspire me and teach me so many wonderful things every day. So I will go ahead and end my talk. And again, thank you to all of you here today.
Mark your calendars now. The 2022 Red Stick Potpourri will be held August 19th through 22nd in Baton Rouge at the Renaissance Hotel. As details are available, they will be posted on the conference webpage at www.laap.org/2022potpourri. After viewing all of the sessions, scan the QR code or go directly to the website to complete your evaluation and claim continuing education credit. If you want to obtain MOC credit, you will need to take and pass the post-test after completing your evaluation. Please reach out if you have any questions or need additional information. Thank you again for participating in the 2021 Virtual Red River Potpourri.